Welcome to another episode of Brain Buzz on the Go. We're here in Miami Beach today with Fawaz Al-Mufti. Dr. Al-Mufti, thank you for being here.
Thanks for having me.
We're going to talk a little bit today about this amazing man that's sitting next to me and also about the Society of Vascular Interventional Neurology meeting, which is taking place right here in Miami. Fawaz, tell me a little bit about yourself.
Thank you so much for having me. I'm honored to be on Brain Buzz. I am a interventional neurologist, a neurointensivist, and I practice at Westchester Medical Center, New York Medical College in Valhalla, New York.
Excellent. So my understanding is that you're board certified in 3 different specialties, is that right?
That is correct.
So, we have a tendency of interviewing underachievers in our podcast, but certainly Fawaz is breaking the bank. So
I guess the best way to start is just explain, this is all a second career for me. So I started out in emergency medicine.
Oh, wow.
And I worked with Doctors Without Borders. I traveled the world, served in multiple war zones, and ultimately decided to move back to the United States.
Right.
So when I moved here, almost 2009, I decided I was going to, I realized I was going to have to redo my training, and I was like, life's too short to do the same thing. Might as well learn something new. I knew nothing about the brain, so I decided to go into neurology. Neurology led to neurocritical care, led to neuroendovascular surgery, hence triple boarded.
Wow.
Not to mention a prior career in emergency medicine.
Yeah, I feel so inadequate doing this podcast, I'll tell you. So tell me a little bit about your work outside of the U.S. and the obviously Doctors Without Border and all that stuff.
Yeah. So, you probably know, the way Doctors Without Borders work is where you have physicians and nurses and hospitals, they don't go there. They go where there's absolutely nothing. They start things from scratch. At that point, I was I'm originally Iraqi, and Iraq was going through the war and everything that was happening there. So I ended up finding myself, by no choice of mine, training in emergency medicine because there was a need. Everybody who could help was essentially abandoned the hospitals. So we ended up being a small group of very junior doctors, essentially running the second largest hospital in the Middle East.
Wow.
In the middle of a war zone.
And that was in Baghdad?
That was in Baghdad.
Wow.
In the middle, under all the everything that was happening there, and then I found myself this is something I needed to do at that point. And then I joined Doctors Without Borders, and Baghdad became my home base. But then I'd be relocated to serve in other war zones. I'm people used to come back home to for some relaxation. I was coming back home to
get
even more anxiety. But that's basically how this all started.
And how is practicing in a war zone? Of course, you have to treat patients, but at the same time, you're worried about your own personal well-being and your personal life. So how does that work?
Yeah, Kimon, this is an excellent question. I think I learned so much from my war experience and practicing in a war zone, because the one thing you need to know how to manage is essentially the people around you. Because to your point, everybody's scared. People around you are scared, and the patients are probably more scared than anybody else. So you end up needing to absorb that anxiety and absorb all of that. And even the way you deal with your partners and your colleagues is going to be very careful, because everybody's sitting on the edge of their seat. Everybody's really anxious. So you have to be very careful. There's a lot of managing communicate. It's all about optimizing your communication, managing expectations, and I'll tell you, it was scary because nobody taught us how to do this. Nobody trained us to do this. I kid you not. At the time, I remember opening up a textbook and saying, "I'm all right, I think this is how we need to do this."
Wow.
It was literally 9 interns. Actually, we were PGY 2.
Right, but to be honest with you, there's nobody else jumping to do that at the time. So you're really offering something that's not available. And also you spoke Arabic, you spoke the language?
Spoke Arabic. So I spoke Arabic, I speak a little bit of Kurdish. I was well accepted within the Iraqi community because I come from a multilingual, and when Doctors Without Borders happened, having grown up in the United Kingdom and in Cyprus, I spoke English very well as well. So it made sense for me to, I was the perfect person to lead some of their operations there.
That's spectacular. I'm very impressed. This is something that's very uncommon with folks that are in our specialty, neurointerventional neurosurgery or neurointervention. it's a very unique background, and certainly thank you for everything you've done in those environments. So let's talk a little bit about neurointervention, obviously your second career. And, we've been talking a little bit about, we have a significant audience that's medical students or folks that are aspiring to get into neurosurgery, neurology, neurointervention. Sure. And we've been giving some tips about the residency aspect. But I want to talk a little bit about how you get to neurointervention, right? Getting to neurointervention is a multi-path, I guess, destination, right? Yeah. So I'm a neurosurgeon, I became a neurointerventionalist. I do the exact same work you do on a daily basis, but you came from a different path through neurology. Yeah. I have a partner that's a radiologist, does the same thing I do on an everyday basis, but he came from a different path. How does it work if you're a neurologist, or if some of our listeners end up being a neurologist?
I think that's an excellent question. When I talk about our field, I like to describe it as like a little bit of that Modern Family TV show. It's people who you think would not work together could not work together, but somehow we make it work. Everybody's coming from different backgrounds. Everybody brings something very unique to the table. From neurology, you would have to do a 4-year neurology residency, followed by a 1 year of stroke neurology fellowship or vascular neurology fellowship, or a 2-year neurocritical care fellowship, and ultimately you do a 2-year neuroendovascular surgery fellowship.
Wow.
It comes up to like 8 years. If you do it through neurosurgery, you have 7 years of residency and probably an enfolded year and then a year afterwards, 8 years. You could do it through radiology, a 5-year residency, 1 year neuroradiology fellowship, and then 2 years, 8 years. So no matter how you splice this up, it ultimately will be 8 years.
8 years.
There are no shortcuts, let's put it this way.
No.
And I think which pathway you choose depends a lot on what you would like to see yourself doing when you're not doing endovascular.
Right.
Or at least that's what I was told initially. I found myself really enjoying being in the ICU, really enjoying managing stroke patients, and hence I did neurology, neurocritical care, as opposed to like vascular neurology, and then neuroendovascular surgery. You did neurosurgery and then neuroendovascular surgery fellowship. But if you think about it, like at this point, I think most of us find ourselves in the end in the neuroangio suite, right? We're not really doing much outside of that.
Right.
I personally still enjoy being in the ICU. Right, I still spend a good amount of time in the ICU.
That's amazing.
But it's hard. It's hard.
You're 100% right. And when it comes to choosing those paths, for those of you guys listening to us, it also comes down, folks coming from different principles. I think that's one of the strengths of our field. Folks coming from different principles also bring different experiences.
Absolutely.
And kind of enrich the field. So you have all this wealth of neurologists doing endovascular procedures. They bring a tremendous knowledge in stroke that comes from the training in stroke that neurosurgeons don't necessarily have. And then you have these guys advancing the field in stroke and going distal and more distal and trying to get more clots and participating in clinical trials in a way that neurosurgeons not necessarily have been doing in the past. Neurosurgeons are bringing obviously knowledge from the open side and what they can do there, and often us that have done a lot of the open surgeries tend to push a lot more for endovascular and kind of push you guys more into endovascular because we know the challenges of the open side.
Absolutely.
And then you have the radiologists who understand a lot more about the imaging, and they're much perfectionists when it comes to images, much more than me, I'm sure much more than you. Yeah. And then they're very device happy, and so they look into more innovation when it comes to devices. And so, kind of marrying these people together is amazing. And, I don't necessarily, it used to be one of the usual debates that we used to have in our societies were, should you do open surgery on this or should you do endovascular? Yeah. And I think the newest generation of endovascular neurosurgery, neurointervention, is really not even considering that question. For all of us, it's just tools to treat the same disease.
100%. And the devices and the tools have gotten so much better now.
Right.
There's no reason not to do it. This is something, you look at some of these aneurysms that we can treat today, apart from the access part, the actual deployment of the device will take what?
2 seconds, really.
Right?
I mean, it's not
no more than 5 minutes.
Yeah, exactly.
No more than 5 minutes.
Exactly. The technical aspect is so short that it's unbelievable that we can still offer that. And so on your everyday life, when you do procedures, do you teach?
I do.
So you have medical students? Do you have residents?
I have residents. I have neurosurgery residents, neurology residents. I have endovascular fellows, and I have neurocritical care fellows.
Excellent. So you teach everybody. So do you enjoy the teaching aspect of your
absolutely
career?
I would say probably the most fun I have in my day is essentially teaching the younger minds about like our field and like what we do. We're affiliated with New York Medical College, which is one of the oldest medical schools, and like a lot of these medical students are slowly gravitating towards neurosciences.
Right.
When I first started, well, not me, but like when we first started this, like bringing neuroendovascular and bringing like the Westchester region to like introducing this technology to the Westchester region, very few people were going into neurosciences. Now the numbers have increased like easily tenfold.
Right.
Very, very impressive stuff. And I'm not saying it's because of us. I think it's just the field is growing.
Right. And what advice would you give to the folks that are listening to us and want to go into the neurosciences, neurology, neurosurgery, neuroradiology, whatever it is? Yeah. What advice would you give to them?
I would say reach out to a neurointerventionalist that is local to where you practice or where you go to medical school. And my suggestion is definitely try to scrub in if at all possible. If not, just sit back, watch from the from the back, just watch on the in the back room, see what things are going. If you're interested in this, it is still very competitive, as I'm sure you know. It's not an easy, especially not an easy fellowship. Of course, you know very well. Definitely try to get engaged in research. I think research definitely makes your life a little bit easier. But those are probably the two biggest advice I would give people.
Awesome. And so the other thing I wanted to talk about today is the Society of Vascular Interventional Neurology meeting. You're the big boss of the meeting. You're running this thing. I'm sure you've been working on it for what, a year or two?
Almost a year.
Almost a year.
Yeah.
And so tell me a little bit about that. The theme of the meeting is ZEnovation, correct?
Yes, it's ZEnovation, a little play on word on like SVIN, which is the Society of Vascular Interventional Neurology, or ZEnovation without boundaries.
Okay.
And my goal this year was twofold. One, to bring innovation to the forefront of our meetings. I remember, no disrespect to any other organizers, but like I remember attending meetings and I say, like, this is ridiculous. If I hear one more talk telling me mechanical thrombectomy works, I'm going to like lose it. We know
because we all know that we do it on an everyday basis.
We do it every day. So
right.
Sure, if you could do it using a different technique, it's not going to work any better. It's going to work. It works. Let's stop talking about that. So my goal was essentially to envision where is the field going to be 5-10 years from now.
Right.
I don't know if you watched Black Mirror as a TV show.
Yes.
Just imagine Black Mirror with a happy ending, a good ending. But if Black Mirror was a conference, that would be SVI in 23.
Nice, awesome. That's fantastic. And go ahead. Sorry, I interrupted you.
No, it's fine. No, and the other very important thing for me was like inclusion. I wanted to make sure that this becomes an inclusive environment for everybody that makes the field strong.
Right.
We're all partners in this, and historically, SVIN attracted more neurologists, and I felt that it's important. Like we've always invited neurosurgeons and radiologists,
right.
But this year I made it a point to essentially invite equal number of neurologists, neurosurgeons, and radiologists, as well as obviously representations from like our female counterparts in the field. So every session had a neurosurgeon, a radiologist, a female representative, or two, whether a moderator or a speaker, and people from our DEI community, committees. So they're also represented.
That's amazing. So. Where do you see, of course, we have these annual meetings and we have a lot of them, different societies and whatnot. What do you think the impact of these meetings is or should be on shaping the field? Like you said before, a lot of times meetings can be fairly dull for folks that are practicing and not contributing much to their everyday. Where do you think, of course, you're giving us a little bit of what you think through how you move this meeting into more interactive and inclusive kind of content, but where do you think things should go and how do you think these meetings can impact what we do on a day-to-day basis?
I mean, I think in my mind, I really wanted, I think that's a great question. I think meetings should challenge you, should stimulate you, should invigorate you to go back to work and say, okay, I'm going to try this. I'm going to try something new. I'm going to try to innovate. If something doesn't work, look into like, how do you fix it? This meeting was supposed to have like, so I divided the meeting into like several paths. ZEnovation in technology, ZEnovation in technique, ZEnovation in systems of care. So how do you innovate systems of care? How do you innovate in technology? How do you innovate in pathophysiology? Like you think, well, pathophysiology is all set in stone. I'm like, but there's new things that we're learning, things that we learned that turns out like they were wrong.
Right.
So I wanted to make sure that like at the very least to stimulate people.
Right.
I had a really hard time inviting people to speak because anytime I give a person a talk, like a topic, they're like, sorry Fawaz, we don't do that. I'm like, nor does anybody else. Like when you're talking about like swarming robotic microgels that you're injecting intraarterially that you literally can program to go into the aneurysm, I'm like, nobody's doing that. I know, but I want us to do that 5 years from now. I want us to do that 10 years from now, potentially. Let's like jumpstart the field so we're not stagnant.
Right. And I think the other thing you did that's extremely impressive and insightful is you shorten the talks so that people don't blabber ad nauseum and then, everybody's asleep, obviously. That was I thought, amazing.
I figured, having attended, like you, I've attended many meetings over the past decade. Within 10 minutes, everybody's on their phone. They're on their phone, like checking their emails. And I was like, in this age of like TikTok attention span, the meetings every talk has to be 7 minutes. There's no time for like it's rapid fire. If you snooze, you lose. You have 7 minutes. You have to give us like the high yield information.
Get your message through,
Get your point across. So yesterday I had one of the speakers. So he was like it was incredible because it was like standing room only. And I was just joking with him. I was like, and he was like, this is incredible. We haven't seen this before. So I was like, I have to take a picture just to commemorate this moment. He's taking a picture. I was like, hey, let's just take a selfie. So we just turned around. We're taking a selfie with the whole room behind us. And at the end of that, he's like, I think I have only 2 more minutes left. That's not fair.
Exactly, because the rules are the rules. And so that's amazing. Where do you see our field going? Where do you see neurointervention going in terms of talking about innovation, devices, but also kind of the pathology we treat? Where do you see the future?
Yeah, I really think we are heading towards like through a blood vessel. You can go everywhere, right? You can go to the smallest blood vessel. You can go to your fingertips. You can go everywhere. So I feel like the field will slowly take over a lot of other areas. Now we're highlighting a lot of the brain-computer interface technology during the meeting. Something I'm personally very excited about. But I think there are going to be a lot of other applications as far as like functional neurosurgery. I like my friends in functional neurosurgery, they don't like it when I say this, but I'm like, listen, we're taking over. We have these stents, we're deploying them in the MCA. Are you telling me I cannot influence, like I can't
stimulate around?
Of course I can.
Or in the venous side?
Or like on the venous side? 100% we can do that. So I think the field is going to go into like even further, further innovation in areas that we haven't gone before. I think you and I saw the writing of the wall before others, and we decided that we wanted to go into this field. I'm assuming like we're probably the same like generation, but when we trained, there were trials saying we probably nobody should be training.
Absolutely.
The trials are negative, and I said, and I'm sure you said the same. We're like, no, this has to work. This has got to work. There's no reason it shouldn't work. And I'm confident that we're going to continue to conquer new territories, new areas, new diseases. From functional neurosurgery, I think epilepsy maybe at some point. Just like where you can you have a vagal nerve stimulator, you can suppress areas in the brain. There's no doubt in my mind that we can do this.
Absolutely, that's amazing. And you're right. So all of us were part of those meetings, the International Stroke Conference and all the other stuff where you had all these negative trials, and it was, remember those meetings, it was like a funeral.
Exactly.
And us, we're just entering a field, we've worked hard, all our lives, like you said, 8 years, we're about to enter a field that shouldn't exist, right?
Exactly.
And then, but shortly, a year later, everything was revived.
Literally, everybody's telling you it should not exist. It's actually, neurointervention is dead. And we're like, no.
Nah, not really. Yeah, it takes a special someone for sure. So enough about medicine. So what gets you excited in life? What do you do outside of work? Which of course is a big part of what we do, but how do you balance yourself?
That's a great question. So I paint for relaxation. I was actually just chatting with my friends. They were like, "Oh, Fawaz, you work too hard. When was the last time you painted?" I'm like, "Let me show you." I pulled up my phone. I'm like, "Here, look, this is my work." I paint to meditate. I paint to stay sane. I love spending time with my family. I have a beautiful wife, a loving, beautiful wife, and I have 4 children.
Wow.
I try to spend as much time as I can with them. Nothing beats that.
You're absolutely right.
So one of the most interesting things about your background is obviously the Doctors Without Borders and your war experience. Is there one instance that you feel, and I'm sure there was many, but is there one instance in particular, or maybe a few, that feel that really shaped who you are today?
I remember this one instance where I was in the way they work is like, these are not large hospitals you're working in. I was tasked with to essentially set up and establish a small medical center with a small operating room and an emergency room with a tiny pharmacy. And the goal was essentially to help populations that did not have any access to anything. And I remember this very small, frail, tiny old lady dragging the son, the body of her son.
Wow.
Looking at it, I immediately thought that he was shot or had some shrapnel or something in his head. I pulled him out. I pulled him in. His body was like it had a lot of red sand, just because she was dragging him. And again, I'm looking around. I'm like, there's no blood. I'm like, what's wrong with him? And she is shrieking. She's literally grabbing at my white coat, pulling him at me, and she's like, please save my son. He's my only boy. And I'm examining him. I'm like, I don't see. There's no way. I'm like, you have to assume that the patient was hit, right?
Right.
I mean, it's like
you're in a war zone.
You're in a war zone. And she was like, he was complaining of a headache, and then he's not functioning. He's not talking to me anymore. So as soon as I opened his eyes, his pupils were blown. He was still breathing very, very shallowly, and I remember, interestingly, I don't think I've ever, that was probably one of the few times where I actually used a fundoscope
right.
in a war zone. It's not such a you use in a war zone.
Right.
But I had one on the wall, I grabbed it, I'm looking in his eyes, and I'm like, what is that? It's like this layer of blood. I'm like, oh, I know exactly what this is. This was Tierson syndrome. I learned about that in medical school. And it was one of the most frustrating moments of my life because this is a very young man who had a subarachnoid. I mean, again, I'm reverse engineering, my clinical, reverse engineering the diagnosis based on small bits and pieces. I don't have a CAT scan even.
Right.
But I think I see blood in the eye, and I'm like, oh my God, this blood was clearly so bad. It dissected into the vitreous space. So, that was one of the moments, honestly, that really shaped who I am. And I felt like if that person was anywhere else in the world, had they not been in that war zone, they could have gotten a CAT scan. They may have been able to help. They may have been able to clip this aneurysm, core this aneurysm. That person could have become like an influencer, a person who can change the world.
Right.
But now he's dead.
Right.
I lost a lot of friends during the war. It's frustrating. Seeing these very young physicians die. And this is not during the war itself. This is after the war, during the civil war, let's call it, or the terrorist attacks that were occurring in Baghdad. Some of my classmates were essentially kidnapped and tortured and killed. And to this day, I still think about them. One of my best friends was an editor on CNN, and he was actually killed by terrorists, shot point blank. And his parents weren't there. I was expected to be the person who would essentially go identify the body, take that body and bury him. I was like, again, I was like an intern. I just finished medical school.
Right.
And this is, and you can't, like, saying no is not really an option, because you can say no, but who else is going to do the job?
Right.
It's either you or nobody else is going to do it.
Right. Wow. And you've taken all these experiences and made a difference in people's lives
100%.
every day.
100%.
Fawaz, thank you. One of the most interesting guests
for having me.
My pleasure. Thank you so much.
We're honored to be here.